Great. And you mentioned also a library. Okay, so this would be a place
where people can go and read books. It will be mostly, it will consist mostly of religious books.
Okay.
But again, a way for parents and children to go and read and explore not only just religious education, but also medicine, and again, just trying to provide this holistic approach to treating a human being.
Okay, but it's interdenominational. There's no coercion. The books are there of the whether it's the Jewish faith, whether it's the Christian faith, the Islamic faith, Buddhism, Eastern religions.
Yes,
it's all there. We all believe in the golden rule. We all believe in the power of positive thinking. These are all common denominators of all our faiths. So you have I mentioned in the preamble that I don't think this is just the answer in Newtown, which it is. It is the answer. You have answered and provided a very valuable service. You will save lives for sure in this very town. Saving a life is like saving a whole world, and that's to your credit and to all of those that help you. But it's also it could be the answer to other towns and other states.
Sure.
So I want you to run with that.
Well, I mean, first of all, it wasn't just my effort. It would have been impossible for me to do, but the community responded, and they are volunteering their time and skills and resources to make it happen.
Yes.
And obviously it's paying off.
Yeah. Yes.
And so in a way it serves as a model for other communities where there is a similar need, and I dare to say that in fact maybe every city and town in the States actually is in need of such similar center and services. Oh,
sure. We have. Well, you were the one that pointed this out. 93 million.
43.
43. I apologize.
Okay. 43 million uninsured adults between the ages of 18 and 65. And obviously, if you assume that most children are insured somehow, and most or all adults over the age of 65 have Medicare, then if you just take that part of the population, that generation between the ages of 18 and 65, we have about 43 to 44 million adults who are not insured.
And this is how did this happen in this fine country of ours?
Well, there is not one reason for that, and obviously if you talk to 10 different people, they'll give you 10 different opinions. Yeah. Even if you talk to 10 different physicians, if you talk to 10 different HMOs or health insurance companies, there is not one single answer. But we are facing this dilemma, and obviously we have to respond, and unfortunately it's been shown time and again that the government is not able to come up with a plan that ensures, health care to everyone, to every citizen. And, in the past and even in the present, the government has been maybe very wasteful in providing these services, be it the Medicaid program or Medicare, and they have realized that they are very inefficient and inadequate in at least this regard, healthcare crisis, and it is a healthcare crisis.
Well, certainly one of the obvious reasons would be the incredible runaway cost of health insurance. I mean, $12,000, $14,000, for a family. It's a lot of bread.
That's a lot of money. And again, I mentioned it the last time that for a lot of people, and I'm not just talking about those who are low income, I'm talking about middle class income. For a lot of people, it's a very tough decision to either purchase a health insurance policy or pay a mortgage.
Sure.
And it's exactly that way for a lot of people because, for one thing, it's very expensive. And unfortunately, in recent past, over the last 4 years, it's becoming not only just expensive, but also more restricted in as far as the benefits provided and the deductibles. And so you can purchase a health insurance policy that costs a dollar amount of anywhere from $700 a month to $1,500
Sure,
a month.
sure.
But with that, you still pay co-pays, you still pay deductibles, you still have a large number of medications that are excluded or on a formulary or off non-formulary medications. And so
sure, I noticed
that.
We all noticed
adds
it.
to the healthcare cost. And the bigger question, the bigger problem, where the majority of those involved in this process, it's cost in the United States about almost one third of all the healthcare expenditure is administrative costs between insurance companies and.
Is there any way that we could cut that out or lower that?
Well, there have been plans, and I know you mentioned about Hillary Clinton's healthcare plan a few years back.
Sure.
And you know, obviously it failed because there's not the willingness to accept that there is a problem, and you add to it the fact that you have about 800 lobbyists that actually represent pharmaceutical companies.
Okay.
And this is only in Washington, D.C. So, and obviously, you know, it's who gets heard and how loud they are. And if you have a large number of lobbyists representing pharmaceutical companies and HMOs, then obviously this is how the system is decided upon.
Okay. Now, if you had your way, Dr. Michael Taweh's way, how would you alter it? What kind of changes would you make that you feel would bring about coverage of every American?
Well, there are different ways of doing it, and there's no simple answer, but we have to start somewhere and we have to make it happen. It has to happen. And one way would be to have a single payer system where you have a health plan paid for by a single payer. That does not mean less services or less than adequate or state-of-the-art medical care. It just means that those administrative costs that total about 31 to 35% of the total healthcare expenditure, that can actually be cut out of the equation, and that's the only thing that changes. In fact, I like to say that it will even make the healthcare system even better. By providing more services and offering more preventive measures, therefore preventing, you know, complications that can be very costly in as far as morbidity and mortality about different medical conditions.
Sure. How many people, uninsured person, let's say, has a heart attack, goes to the hospital, gets, you know, the MRI, all of the, you know, state-of-the-art Cadillac attention, and never pay that bill?
And it happens all the time, and it happens every day. And in fact, when we sat down with Danbury Hospital to, when they had the willingness of helping us by providing a very essential element of running this operation, it was realized that not only Kevin's Community Center is benefiting from this, but also Danbury Hospital, because if you have a patient that can come to the clinic and be treated, and with that avoiding further progression of a particular medical condition, if that same patient ends up in the emergency room, it'll cost the hospital at least anywhere from $1,000 to maybe $20,000.
Where if they got the antibiotics at the right time, they wouldn't have had the
and this is a typical
situation.
example. This is a typical example.